Today I'm joined by our very own Suzi McGowan to talk about electronic muscle stimulation and the benefits this can bring to people with facial weakness. So my first question to you, Suzi, is why is facial physiotherapy important in NF2?
Well, it's amongst a stream of things that can benefit NF2s, and I think with facial physiotherapy, of course, we all know that one of the hallmarks of NF2 is sort of bilateral acoustic neuromas or vestibular schwannomas, and they grow on the 8th cranial nerve, and so one of the risks of the tumour growth on that nerve, or the removal of a tumour on that nerve, is damage being caused to the 7th cranial nerve, which is the facial nerve. So lots of NF2ers have issues with facial palsy after that surgery, and it can cause things like severe dry eye, problems with eating, muscle movement, smiling, drinking, muscle control, lots of things. So after the damage happens, so usually it occurs straight after surgery, it's almost like a concussion on the nerve. And they say, I think, within the first 6 months, you don't see a lot of change. And then after 6 months, it starts to almost repair itself at that point. But the problem with facial palsy is it can very, very rarely repair itself without assistance, and sometimes even with assistance, it doesn't fully restore to sort of what it once was. And so in some cases, people with more severe facial palsy might go down the route of more surgical interventions. And so this may be sort of like nerve grafting or muscle transplanting, you know, whereas you have sort of milder cases of facial palsy, like myself as an example, and you may use things like facial physiotherapy, or in some cases people have wrinkling on their faces from where the muscles have sort of changed the movement. And so things like Botox can be provided by the NHS to help those things as well, and they're just sort of less invasive ways of helping to target nerve damage in the face. And so for me, I'm having facial physiotherapy at the moment, and hopefully that will help with some of the issues that I experience from facial palsy. And the facial physiotherapy itself can consist of sort of one or two or both things. So you may have sort of massages, exercises for your face on one hand, and then in some cases you would also use electronic muscle stimulation, or EMS, and it's quite a specialist area to work in, so it's super important that you work with someone who is experienced in working with NF2, particularly in the facial palsy side of things, because NF2 facial palsy can sometimes, it will make a difference on how that treatment is provided. And so basically, when you think about the facial nerve itself, what it does is it sort of emits this electrical impulses to the muscles, and that gives them the shape and the tone, etc. And so when the nerve itself is damaged, then those signals aren't received anymore, so it results in weaker muscles, and that's where we experience difficulties in facial movement and things. So currently I'm very early stage of my physiotherapy at the moment, and I'm using an EMS machine in my sessions. And so the idea is that the stimulation from the machine mimics the signals that the nerve would provide to the muscles in a normal circumstance, and the electrodes basically are placed in different areas around your face depending where you're most affected, and they're so specifically placed, and that's why it's so important to work with someone who's a specialist in this area. And you know, if someone was to go out and just sort of decide to do it themselves, you can end up causing a lot more damage. So it's really important to sort of have it under guidance, if you like. And then that's sometimes used at the start of the journey, and then it sort of wakes the muscles up a little bit, and then you can start doing more physical like massages and exercises and things.
Thanks so much for that. So, in your experience, are you just recovering from the ear surgery or had some recent damage?
Well, interestingly, the damage I had from my nerve was actually about I want to say about 12 or 13 years ago. It keeps changing, I can't remember. I think it's about 12 or 13 years ago. And I've noticed sort of decline in my functions over the last 12 months. And so it sort of made me pay a little bit more attention to things. And back when I had the original damage, I had lots of physiotherapy to my face. And we also used the EMS machines very early on after the damage. But it sort of gets to a static point where you can't do much more. And so I just sort of stopped doing physio at that point. But like I say, about a year ago, I started to notice some changes, particularly around a loss of tone and almost like noticing an increased loss of being able to make certain mouth shapes and things. But really, those are sort of what they would say just artificial issues, if you like. Really, when it came to sort of issues that I started to really affect my daily life, was I was getting to a point where I was finding it difficult not to drop food every time I ate, or to draw drink every time I took a drink, you know. And so I became really sort of self-conscious about it. And I started getting really sort of nervous around having photos taken and things like this. And so I decided, well, you know, it's been some 12, 13 years since I went through this process. So maybe there's something I can do now that I can try and just improve it a little bit. So I thought, well, what have I got to lose? So I got in touch with the NF2 team, and you know, they were really helpful, and they were sort of honest about the situation, you know, because I think when you are surrounded by people that want to be supportive and they want to make you feel good, you know, they'll say things like, oh, I didn't even notice anything with your face, or, you know, it looks really good. And, you know, I can really understand where people are coming from sometimes, but it just makes me feel like I'm a bit self-indulgent, like maybe it doesn't validate that these things are affecting me, you know. And so it was nice that the NF2 clinic were open to talking to me about it anyway, so that was really helpful. And I had no idea at that point if there was anything that could help, and even what I'm doing now might not help, but I always think it's just worth giving it a go. It's worth asking, you know. And so I thought, well, you know, what could I lose?
Yeah. So how did the process get started? What was your first step?
Well, the first step, of course, was speak to the clinical team, and that actually took me a really long time because, like I said earlier, you know, people kind of make you feel a little bit like maybe you shouldn't be feeling this bad because you've got really good function. And so I felt kind of a bit guilty for a fair amount of time. So it took me a while to make that first step, but I actually spoke to my neurosurgeon. So I was having a clinic through lockdown, and of course, you know, you're very limited by who you see in those virtual clinics. And so I was speaking to my neurosurgeon, and again, she was really sympathetic about my experiences and how I was feeling about it all. But she didn't actually think there was anything that they could do. And, you know, she referred back to the kind of, you've got really good function. I don't think there's anything they can do to help you. And, you know, it's not exactly what I wanted to hear at that time, but I was also quite open, so that's probably the reality of what I might hear, you know. But what she did say is that what we can do is try and get some funding for you to at least have an assessment with a facial palsy specialist. And so that's what she did. So she referred me then to the Lyndon's Clinic, which is I want to say it's near Manchester anyway. I couldn't tell you exactly, and that was the process really.
So eventually you managed to access physiotherapists. What happened when you first met them? Was it difficult to access during lockdown?
Yeah. I mean, I thought I would have to wait until after lockdown to, to get an appointment, but actually it was in sort of a few weeks. I got an email and said, oh yeah, we'll set it up virtually, no problem. Oh, okay, I didn't expect that to be that quick, And before you get the first appointment, they sort of send you lots of paperwork to fill out. There's always loads of paperwork, but it was really comprehensive. So they sort of want to ask you about your experiences, what are your goals, what you're hoping to achieve, what do you find difficult, and then that helps to sort of preempt the conversation before you have the assessment, and also makes it a bit more beneficial when you've got time constraints as well. And so it was just about giving as much information as possible. And the assessment itself was the purpose of it was so that the physio could write a report for the NF2 clinic, and that was really just to state whether there was anything they could do, whether there was any chance they could improve anything, because obviously if the physio says you ain't going to get any better than what you've got, then the NF2 clinic aren't going to fund it. Why would they, And so they look for clues. Well, of course, physio is a specialist here, so she would be able to identify if there was room for improvement, and they do lots of measurements, as with these clinicians love to do measurements and sort of objective views on function. So they use something that's called the House-Brackman scale, and that's basically exactly what it is. It assesses the function of your facial nerves and your facial functions, and so this kind of directly influences what your funding success chances are going to be and the outcomes of whether you get physio or not. So during the assessment itself, it was like, sort of the usual assessments you do with your NF2 team: lift your eyebrows, do a smile, make an O, tighten your face, all those sort of things. And so she really went through all the sort of normal movements that we get asked to do around facial palsy in clinics, And but what was amazing about her was she was really, really clear about the expectations and about how I shouldn't really build myself up too much hope about what the outcomes could be. She was very clear from the onset, you've got really good function on a sort of clinical marker basis. And she said, so, we're not entirely sure what improvements we can see, but she definitely thought there was a chance to be able to improve some of the movement that I was having difficulty with. And so what she recommended was that I went through a program of using the EMS machine and then having facial physiotherapy as well. And so after that, she sends the report over to the NF2 clinic, and actually I didn't know that the funding had came through until I got an appointment letter. And so I was sat there sort of waiting, expecting for this, right, just to let you know the funding's been denied or approved, and I kind of really thought that it might be denied, to be honest with you. But yeah, then I got this appointment letter and I thought, oh, amazing. I'm going to start moving forward with this. So I got really super excited about that because, like you say about lockdown, it's all done virtually at the moment. So I was a little bit nervous about how that was going to work. And so what they did first of all is they posted out the EMS machine to me. And the idea was that in the first session, she would go through a placement and about how to use the machine, and then we sort of move forward in the journey. And again, through that, before the session started, it was just about, again, managing those expectations and things.
Sounds like they've been really great. So how long have you been doing this treatment, and how long will it last?
Well, I'm in really early days, and the idea at this stage is to do the EMS machine first, and then hopefully that will get my muscles kind of going, oh, hi, yeah, I'm awake again. And then I'll do that for a month. and then we'll sort of start on the sort of exercises and massage work. So I'm really early at the moment on it.
Okay. Now I know you've been doing the electronic stimulation part first. What is it like? Can you describe your experience?
Yeah, it's a really strange sensation. I mean, it's a bit sharp when you first start, but actually by the end of it, it feels quite nice, you know, really weirdly. And it's kind of like a bit of a tap, you know, and in some ways, when it's a bit too high, I've described it to other people like being flicks in the face. So it's quite bizarre. I mean, anyone watching that's sort of had neurophysiology electrical tests for neuropathy or anything like that, or a tennis machine, they will know what it feels like. It's extremely similar, if not the same, as those feelings. So it's basically like that, and you know, you set the levels that you want to use when you're comfortable. Those sort of your set levels, and you do that during the first session with the physio, and she literally will go through watching you fit your placement. She'll take a photo of it so that you can use that for reference on the next time. And let me show you. So this is the machine itself. All right, now because my memory is so full, I put little stickers here, and these numbers are sort of the levels that I have them at. And so you turn it on, you set the levels that you want, and then you press go and you just sit and wait. So for me at the moment, I do 1 hour a day for a month. And it's basically the machine itself is sort of connected to these electrodes. And the electrodes will sit on specific places in your face, like I say, wherever you're having the difficulties. So it might be like you have 2 for every area, and it's a bit like a car battery, if you like. You need conductors with it all, so maybe there, or in different places around your face. And then you put some electrode gel on it, and then you literally stick it to your face. And that's as simple as it is. And there's like at one point, I thought, oh, well, I managed taking a little drink at the same time. Don't do that. Don't do that. It will give you a hell of a shock if you get a little bit of water on that. It also cut the machine out. I hope my physio's not watching. But essentially, when you're doing it, you want your face to be sort of as relaxed as possible. So I'm not supposed to do any work or do anything that might cause tension in my face while I'm using the machine. So literally have been prescribed just sitting back and watching Netflix. So that works out quite well. And like I say, you know, sometimes when the machine itself is the level's set too high, it can get quite uncomfortable. So it's like someone flicking your face, or even with an elastic band if it's too high. So yeah, it can get, you know, quite uncomfortable. So really after that point, well, for me, I'm doing 1 month of 1 hour a day with the machine, and once that's over, I have my second session, and that will be where we'll start to introduce exercises into the face, and then really it'll just be a continue along from that journey. When we get to the end of the journey, we'll assess it, see if there's been any change in function and any improvements, which is we're hoping, you know, and see where it goes from there. But it's nice to sort of understand, I think, for people with mild facial palsy, that, you know, there are options out there to be able to try and help improve it. And yeah, so definitely it's worth having a chat with the NF2 team, and definitely worth trying to see if there is an opportunity for you to be able to see a facial physiotherapist, really.
Thank you so much. This has been really interesting. Are there any final comments you would like to make before we sign off?
No, I think that's it, really. I think one thing, really, I mean, for me, you know, my facial palsy was a long time ago, and I genuinely thought at this stage there was nothing that I would be able to do. So it's kind of like almost a bit of a tip, if you like, you know, if you are feeling like maybe you would like to try something. I'm not saying that it would help. It may be that there's not actually anything they can do, but it might be that there is. So sometimes it's worth just asking if you feel like you want to.
Definitely. Okay, brilliant. Thank you again. We're finished for now. Okay.
So
Bye.
welcome. Thank you.
Okay.